and welcome back to iHealthConnections episode 4. I'm your host, Dr. Rashmi Nair, and today's episode highlights 15 surprising facts everyone should know about Medicare. Let's begin with a short intro into Medicare before we dive into 15 surprising facts about Medicare. Medicare is a government-sponsored health insurance program which is intended for people who are 65 or older. Some exceptions are younger people with disabilities or people with end-stage renal disease or ESRD. Medicare has 4 parts. Medicare Part A, which is the hospital insurance and covers inpatient hospital stays, care in a skilled nursing facility, hospice care, and some home health care services. Medicare Part B, which is the medical insurance, covers certain doctor services, outpatient care, medical supplies, and preventive services. Medicare Part D, or prescription drug coverage, helps cover cost of prescription drugs, including many recommended shots or vaccines. Medicare Part C, also known as Medicare Advantage, covers Medicare Part A, Part B, and Part D, and it is offered by private health insurance companies. Most people don't pay a premium for Part A because they might have worked for an employer who has been paying Social Security and Medicare taxes. If you look on your paycheck, it will reflect as a FICA tax. So as long as you have worked for an employer for 10 years, you qualify or you meet the minimum 40 credit that's required for you to get a premium-free Medicare Part A. If you don't qualify for premium-free Part A, you can buy Part A. Everyone pays a monthly premium for Part B. Once you enroll, you will need to decide how you will get your Medicare coverage. There are 2 main ways. One is Original Medicare and the second option is Medicare Advantage. Original Medicare includes Medicare Part A, which is the hospital insurance, and Medicare Part B, which is the medical insurance. You pay for your services as you get them. When you get services, you will pay a deductible at the start of each year, and you usually pay 20% of the cost of the Medicare approved service, which is called as the co-insurance. If you want drug coverage, you can add a separate drug plan, which is the Medicare Part D, the prescription drug coverage. Original Medicare pays for much, but not all, of the cost for covered healthcare services and supplies. There is a gap. So most people choose to buy a Medicare supplement insurance or a Medigap insurance policy, which will cover any gaps in their Medicare coverage. These Medigap policies help pay some of the remaining healthcare costs like co-payments, co-insurance, and deductibles. Some Medigap policies also cover services that Original Medicare doesn't cover, like medical care when you travel outside the US. Medicare Advantage, on the other hand, is an all-in-one alternative to Original Medicare. They bundle the plans which include the Part A, Part B, and usually Part D. Most plans offer additional benefits that Original Medicare doesn't cover, like vision, hearing, dental, and even gym benefits. Medicare Advantage plans have yearly contracts with Medicare and must follow Medicare's coverage rules. The plan must also notify you about any changes before the start of the next enrollment year. I have covered Medicare Parts A, B, C, D, and the Medigap policies in detail in my episodes 5 and 6. Now, without further delay, let's dive into the 15 surprising facts everyone should know about Medicare. Fact number 1. In United States, Medicare provides healthcare coverage to more than 55 million Americans. Every day, another 10,000 people turn 65 and become eligible for this government-sponsored health insurance program. The rules for enrolling into Medicare are complicated, and what you don't know can hurt you. Did you know that once you turn 65 and start collecting Social Security benefits, you must enroll in Medicare Part A, which basically covers the hospital cost? If you don't want to enroll in Medicare, then you must repay your Social Security benefits. Also, once you enroll in Medicare, you can no longer contribute to health savings account, even though you can continue to take tax-free distributions from your HSA to pay for your medical expenses. Basically, for older workers, they have to choose between signing up for Medicare coverage or continuing to make tax-deductible contributions to an HSA because they can't do both. Surprised? These are actually true. Fact number 2. If you missed signing up during your initial enrollment for Medicare Part B, you will pay a delayed enrollment penalty for each year you were eligible but failed to enroll. There is also a 1% per month delayed enrollment penalty for Part D, which is the Medicare prescription drug plan. The only way you can skip being penalized is if you continue to work after 65 and covered by a group health insurance through your employer or union. In addition to paying a late enrollment penalty for life, for missing the initial enrollment, you may have to wait a year or more to enroll in Medicare. Fact number 3. If you make more money, it will cost you more to obtain Medicare. While most people pay the standard premium amount, many will pay a higher premium for Medicare Part B based on their adjusted gross income. Fact number 4. Original Medicare only covers 80% of the eligible medical expenses, so you're still responsible for 20% of your coinsurance. It is recommended that if you participate in Original Medicare, you should purchase Medicare Supplement Insurance or Medigap insurance policy for the gaps in coverage as a backup. Fact number 5. There are many services that Original Medicare doesn't cover. Did you know that Medicare does not cover long-term care costs? If you're a senior over 65 and need some form of long-term care, then it is recommended that you purchase long-term care policies which can help you cover for these costs. Original Medicare also does not cover dental, vision, or hearing services. The only exception to this is if you're admitted in a hospital and get dental services while you were admitted. Then Part A covers the cost. The other exception is Medicare will pay for diagnostic hearing and balance exams if a healthcare provider has ordered these tests to see if you need medical treatment. Fact number 6. Under certain conditions, Original Medicare will cover certain weight loss services and programs. Example, if weight loss is required as part of your treatment for diseases like diabetes, hypothyroidism, or any cardiovascular conditions, then Medicare will pay for this program. Fact number 7. Medicare supplement insurance plans or Medigap plans offered through different insurance carriers have the same coverage. For example, Plan F with United Health and Plan F with Cigna are exactly the same, only the cost varies. So, shop around and find the cheapest plan that works for you because they all have the exact same coverage. Fact number 8. For seniors who love to travel, Original Medicare does not cover your health services while traveling outside the US. But if you have Medigap policies, some plans might pay for health services while you travel.
Keep on listening for the bonus.
Fact number 9. Do not wait to choose a Part D drug plan. If you are enrolled in Original Medicare, make sure that you enroll into a prescription drug coverage plan or you will pay a penalty. Even though you're not required to have a drug plan, there is a penalty for every month that you were eligible but did not purchase coverage. Fact number 10. Medicare Advantage or Medicare Part C is an alternative to Original Medicare coverage. Medicare Advantage is healthcare coverage offered by private insurance companies that are approved by Medicare and provide coverage for Part A, Part B, and Part D. As compared to Original Medicare, which is a combination of Medicare Part A and Part B, one of the biggest perks of being in Medicare Advantage is that some plans might not have a monthly premium, and the benefits include dental, vision, and even free gym memberships. Fact number 11. Medicare program is running out of money. Every year, cost of Medicare has been increasing, and this means that Medicare is spending more than what they are making. Fact number 12. Medicare scams happen way more than what you think. Scammers use Medicare to trick seniors into getting out their personal information. They try to get your Medicare number or personal information so that they can steal the identity and commit Medicare fraud. Fact number 13. Medicare does not cover all costs for cancer patients. Only 38% of cost qualify as medical expenses. The remaining 62% classify as non-medical expenses and therefore are not covered. Example for non-medical expenses are travel expenses, lodging, and even experimental medications sometimes do not qualify for the coverage under Medicare. Fact number 14. Thanks to the pandemic, Medicare now covers telehealth. Although most Medicare Advantage plans have been covering telehealth plans for years, traditional Medicare or original Medicare restricted the service only to certain devices and practitioners. Now, due to COVID or coronavirus pandemic, telehealth was expanded so that patients could use smartphones in their own homes to consult with a broad range of medical professionals. And this feature is here to stay. But Medicare offers no discounts for telehealth, and in most cases, beneficiaries pay the same cost for virtual visits as those in an office. Fact number 15. In 2020, the donut hole for Part D, which is the prescription drug coverage, has been filled. This is a coverage gap which was faced by many seniors, and they had to pay a higher out-of-pocket cost for their drugs. This is no longer the case. For 2021, the coverage gap begins when the total amount the plan has paid for the drugs reaches $4,130. At this point, you are in a donut hole where you will now receive a 75% discount on both brand name and generic drugs. Prescription drug manufacturers pick up 70% of that tab and insurers pick 5%. The remaining 25% is going to be paid by you. Once your out-of-pocket cost reaches $6,550, catastrophic coverage begins. This is where the government picks up most costs. The maximum spending limit for beneficiaries in 2021 is $200 higher than the 2020's cap rate. Any deductible paid before you enter the donut hole counts towards that annual maximum, as does the 25% that you contributed while you were in the donut hole. And the 70% that the pharmaceutical companies paid on behalf of you also counts.
It's time for the bonus.
Fact number 16. In 2020, nearly 2/3 of Medicare Advantage enrollees pay no supplemental premium. 90% of Medicare Advantage plans offer prescription drug coverage, and most Medicare Advantage enrollees are in plans that include this prescription drug coverage. Thanks for listening to this episode. Want more from me or want to be a guest on my show? Whatever it might be, you can go to iHealthConnections.com and drop me a note or comment in the contact section. I'll be covering a lot of some very cool stuff, so be sure to subscribe to the iHealth Connections podcast so you don't miss any new shows that I put out. You can also find me at Dr. Rashmi Nair on Twitter. Thanks, I'll see you around.